Welcome back to the Crooked Spine Show. Today's talk is episode 2 with Derek and Dr. Tony, Derek of lpcoaching.com. We talk about starting with how do we get out of quarantine, how do we get back into working out, how do we get back without hurting ourselves through his assessment and what that entails, along with recovering from a hamstring injury and what the foundational phase is in his training to get your body overall healthy and stronger again. We talk about also foam rolling, how that's important for overall stretching routine, along with homework and how homework can include working out at home, working out in a gym, and doing it properly and doing it on a schedule and on a routine so overall body can get the benefit of working out properly with a trainer. Also, too, we talk about shoulder rehab for either Joe or Jane, also the athlete, how that's important, and how shoulder tightness can cause injuries over time, especially if you are an athlete or someone who does a weekend warrior. Also, we talk about, too, is what is optimal range of motion. With tightness, range of motion is important to understand what normal is for you, what normal you can get to, which is optimal. Also talk about, lastly, with how does the trainer help you through all of this, either recovering from injury, getting out of quarantine, getting back into it without causing more injuries for yourself or re-injuries. Right, so I hope you enjoy the show. Again, the show has the highlights of the actual topics we just talked about, along with links to Derek's website and also Facebook pages and other stuff too. And if not, let's go right to the show, and I'll talk to you afterwards. Hey, welcome, guys. This is Chiropractic Clinic. I'm the host of Crooked Spine Show, Dr. Tony Rakovic. This is Derek with LP Firmix. We're doing this Zoom live now. Not live, obviously, but we're going to do this down the line. We're trying to give you guys information as we're at home. I'm at my home office. I'm not wearing my normal office attire. Mr. Derek there looks comfortable in his heated office in his company, which is great. I'm jealous. A lot's going to be how do we keep you guys and girls healthy and ready to when this thing does drop, this coronavirus does end, how do you get back on track? How do you get back in your program right away so we don't lose track and we don't lose the performance we've built up over the last couple months or so? So Derek, we talked about, I think last month was the actual evaluation of someone's body, how we walk through that, how do you figure out what their strengths and weaknesses are. That point, we focus on the weaknesses. How do we get them better so the overall person and body and athlete gets improved to get the next step, which is now going to talk about how do we start training? What do we start doing, Derek?
Yeah, absolutely. Thanks again for having me on here, Doc. I mean, I love doing the show with you, man. This is awesome. So
it's fun.
What happens after the assessment is it gives me time to go through and take a look at my evaluation, obviously, and see what the assessment has revealed to me regarding the mobility, the flexibility, the strength, and the movement quality of the individual. So what that's going to let me do is begin to develop a personalized program that's going to meet those needs of the individual. And I use the word needs as opposed to maybe goals or desires that a client has, because the first thing that I'm obligated to do as a strength conditioning and sports medicine specialist is to use my evaluation information and then apply that expertise to correcting these ailments that pretty much every client I have or that I deal with has. Very, very, very rarely will I encounter an individual who doesn't have deficiencies in those areas that I just mentioned. About 2 weeks ago, maybe 3 weeks ago now, I assessed a young guy, football guy at Oregon State University, and his agent referred him to me. And the sole purpose of the evaluation was to figure out where he was at risk for injury in his preparation for the NFL Combine. And so I went through, and he had a lot of deficiencies with he had some stability issues that were negatively affecting the way his hips and hamstrings were functioning. And he had lo and behold, he has had hamstring issues throughout his collegiate career, Okay. So what I did was I was able to explain to him how these stability issues in his joints were affecting the overuse of the hamstrings and why this was causing continuous straining in the muscle group, because he was extremely fast. He was a cornerback. And so, I mean, he's lightning fast. And when you are able to produce that amount of power that these men do at the rate of speed that they do, the hamstring muscles will they're so prone for pulling, That's why Olympic
Yeah.
sprinters, you see Olympic sprinters, they're so concerned about the hamstrings, right before they get in the blocks and stuff like that. They're always kind of pulsing the muscle and stretching it and lengthening it. And what's his name? The receiver for the Browns. I'm having a blank right now. One of the top receivers in the NFL. He started talking about when he had a great run during the season. He says, the only thing I was concerned about was I just was hoping my hamstrings were going to hold up. He said that in his interview.
We see it so often to where guys are running down the field and all of a sudden they pull up gimpy for no reason at all.
Yeah, you're right. And so that's one of the things. So getting back to the question I will go through, and what I'll do next is after I go through and I analyze the assessment, I will look at where I believe the level, so to speak, for each one of those areas that the client should begin his training at. So for mobility, for flexibility, for functional strength and movement quality, I will determine which exercises, the intensity of the exercise, as well as the volume of the exercise, where we're going to begin at. And then I put that program together in a way that is going to enhance them in all those categories. And I'm going to do that in a professional way that is going to challenge them very much so, but it's not going to overdo it. And we're not going to over fatigue them either. I'm going to
part of it, going back to, for example, his hamstring issue. How would you start rehabbing that or getting that to a more efficient state? What would you do?
So for him, it was an issue of the surrounding muscles and joints that weren't performing properly, and thus causing an overstrain on the hamstring.
Okay.
So I would choose exercises that are going to strengthen his stability and mobility a little bit in the ankle, which was one of the things that he needed. He needed some glute medius, which is the smaller upper outer portion of the glute area there. That needed to be strengthened. So I would just pick and choose exercises that would do that for him.
You mentioned two different muscles. Are the antagonistic muscles where the hamstring is antagonistic to the quad and connects to the tricep or the calf muscle to the ankle? Is that what you're talking about? Or if that hamstring's tight, is the tightness or weakness of the quad going to affect the hamstring strength or injury proneness?
It can, yeah.
Okay, that's what I'm worried. How do we look at, if that's tight, if that's an issue, how do we move around the body? Okay, if that's tight, what can we do to make that there's less stress on that hamstring? Is that kind of
a great way to think about it is that I'm trying to create a body that is in balance with each other.
Yeah. Okay. Got it.
We want both sides of the body to be, damn near equal in strength. We're obviously neurologically prone to being better, so to speak, at using one side of our body as opposed to the other. Obviously we're either right-handed, left-handed. Prefer to kick with one leg or the other, so to speak.
My left side doesn't work. My left side is disabled, I think. I don't know what my left side does.
So we're trying to, as a strength conditioning specialist, you're trying to make sure that the body is in a state where it can functionally perform for the general fitness client and as well as the athlete.
Okay.
So I am in the initial phase of training. I refer to it as the foundation phase. I am making sure that all my clients, whether they are fitness, weight loss, strength training type client, an athlete, or especially a rehabilitative type client, that their bodies are in balance. Now, when I'm working them towards achieving a balance in the body like that, the body is going to function and distribute energy optimally. And we are not going to be prone to any overuse in any joint area.
Okay.
And that's going to allow for optimal movement quality. And with optimal movement quality comes your progression towards optimal physical health.
Well, a lot of it, I think in my sense, interpret that is going to be, if I can get to a point where my body is equally balanced, equally strong and flexible, then my actions may be on the field or off the field at a football game, at a baseball game, or even getting out of a chair at home or working around the house, I'm less prone for injury. That kind of for the average Joe like myself.
Yeah, dude. My average, the average fitness client is 50 years old. 50 to 55 years old, 15 to 20 pounds overweight, and they lack a tremendous amount of flexibility in the hamstrings and hips, hamstrings and hips. Their spine is usually, somewhat kyphotic, meaning rounded forward. And my opinion on that, I noted it in our last conversation, is because of the phones. And that we are we're very much, the body is curved forward, looking at the phone often, and the body remembers, the muscles remember positions that they're in, and they will gravitate towards those positions because it's kind of like it's comfortability thing,
You're adapting to your environment. There's a way to say that. If your environment is sitting a lot, looking at your phone, at that point you're adapting. But so how do we, like you mentioned, when you get that tight hips, tight hamstrings, tight lower back, for example, too. At that point, we go into a sedentary lifestyle. And then, like you mentioned, too, how do we, now that we know there's a tight hamstring, how do we go from there to start rehabbing? What specific exercises do we start doing, Derek, to get that to start loosening up, to get someone to go from, okay, I've done nothing. I probably have an injury. I've even had an injury right now where it's tight, so I'm apprehensive and anxious about it, fearful of making it worse. How do I start something? What do I do?
Well, the first thing I would recommend that you do is that you seek professional help. If you're out there and you feel like, here's what's gonna happen with the coronavirus, in my opinion. Okay, people are going to be sitting around for almost 3 months, and I bet you there's going to be so many people out there that are going to put on probably between 13 to maybe 17 pounds. I bet you it's going to happen, because working out in your house, in my opinion, sucks. Okay.
Agreed.
It sucks.
Thumbs up.
Okay. I have always had a spinning bike in my home because I kind of like on Sundays and to ride that bike a little bit. And I got it right by the window. It's nice to roll the window down. I got a nice little Sunday morning ride there, and then I take my shower, kind of get the day started before I head over to church. But continuously working out. I have trained extremely wealthy people, okay, where I go into their home and they have this elaborate, beautiful in-home gym. I've done that, and you go in there and you charge them $150 an hour and you bang them out. But it's like half the times they after a while they'll would rather prefer to come into the private facility.
You go back to their place, I'm assuming, and all of a sudden you have to spend 10 minutes just dusting everything off.
Dude,
it has been easy last time you went in.
It's not a good environment. You're by yourself. Personally, I don't really like it.
I know.
So people are going to do that for a little bit, and they're all gung ho about it, and then they're going to get tired of it, and then they're going to be bored. And then when most people are bored, they eat and drink, right? And so here comes the weight. All right. So the sun's going to come out. It's going to be summer. All the virus stuff's going to be over. And people are going to freak out, and they're going to want to lose 20 pounds as fast as they can.
Tomorrow, I want it gone.
Dude, they're going to go out there, Anthony, and they're going to try to run too far, and they're going to hurt themselves. It always happens. They're going to hurt themselves. Right?
That's the plan.
And so then they're going to start calling. And, the first thing they're going to come in here with is sore hamstrings, sore hips, and sore knees, and sore lower backs and necks. That's just the way it works.
Yeah.
You know that. You're a chiropractor. You deal with that more than me. So the first thing that I'm going to do is obviously assess them. And then to go back to your question, let's say we use the hamstring for an example because it's so common. Okay. Mm-hmm. So if the hamstring is tight, the first thing that you want to do is kind of look at the muscles that kind of work synergistically with the hamstring. So the hips and glutes. the hips and glutes. So we're going to need to make sure that you can't just always try to stretch out the hamstrings, because a lot of the times people will have a fairly loose hamstring, but the hips will be tight and the glutes will be tight, and so we're not getting active range of motion through the hip joint, and that's causing overuse from the hamstring, and then we get strains, especially in well, I shouldn't say especially. It's kind of a combination in both sprinters or explosive athletes and endurance athletes.
Some intensity athletes where it's stop and go, right?
Yeah, the strain will usually occur in different parts of the hamstring based on the activity of the individual. Explosive people generally have high hamstring strains. More endurance-based people have a little bit more of a lower hamstring strain near the knee down there. Okay, so that's been my opinion, or been my experience dealing with them. So obviously, the first thing you want to do is try to loosen the muscle that is tight through dynamic as well as static stretching. I also believe that it's very important to keep the fascia loose and supple. And
What's
so
the
this
fascia?
is like muscle.
Got it, okay.
Okay, so this means this would be like what's really common in our culture, foam rolling.
Mm-hmm.
Right? Foam rolling, massage sticks, all that kind of stuff, rolling around on different balls and stuff like that. That's extremely important for kind of prepping the muscle to handle to handle stress, as well as
like Tiger Balm or something that's warm in the tissue that kind of gets inside the tissue to inside the muscle.
That's that kind of stuff, like icy hot and those kind of things. They do something to the skin that does promote a little bit more blood flow to the area, and is supposed to help warm the area up, so to speak. But essentially, I remember when I used to work in the physical therapy clinic too. The Dr. Mike and I, we kind of both agreed that the icy hot and the Tiger Balm, it does do a little bit there and kind of warm it up, but it's more the rubbing of the muscle.
The friction.
Yeah, the friction that brings the blood flow to it. So are those things a little helpful? Yeah, they sure do a good job psychologically with people, it makes them feel ready to go. But
You're
it's
doing
really,
something.
it is, Doc. But it's more the rubbing of the muscle that's doing the job there. And that's why I do like the foam roller. I have a foam roller routine that every client learns. They are instructed on how to foam roll their entire body, and throughout the week, they're asked to do that for a certain amount of repetitions per location. I also like those sticks, the tiger tail, or just the regular old stick. You can buy them at Target, like for $11. Those kind of things are great for like a quick little heat up before a workout or before a run at the house, and they're very inexpensive with that.
That's good.
Yeah, I like those a lot. But to go back to your question, it would be to target the area, and seek professional help so that you can have a complete understanding of the areas that could be also affecting that one tight area, like I mentioned, those in regards to the
like going back to our first talk too. It's like once that might be the hamstring you're worried about, but the problem is, like you mentioned, other muscles around the area, associated muscles, that you have to look at the big picture, not just you didn't just pull a hamstring. There's something going on there that's the reason why you pulled a hamstring.
Yeah, sometimes go ahead, Doc. I didn't mean to cut you off. I'm sorry.
That's okay. And I worry about it is someone has that happen maybe once, okay, and they go back again and do something, and they stop working out altogether because they don't want to hurt themselves. Now their whole body gets more sedentary, tighter, weaker, and now they have to start all over again. I think by seeing a coach, by seeing a professional, allows you to realize what's going on in your body, give you the confidence to start these small steps to get back to your normal activity level, so you feel confident up here you're not going to cause another injury.
Yeah, I agree with you. I totally do. I mean, for whoever is watching this, it's like, if you're thinking about starting an exercise program, I mean, you have got to really look at the credentials of the person that you are considering to help you, and I really encourage those people to look at the diversity of the credentials, because there's a lot of fitness trainers out there that are very good fitness trainers, but their education is been primarily directed to just that fitness. Okay. And there's nothing wrong with that. That might be their passion. They can be 20-year professionals. That's their passion, right?
Yep.
But what I chose to do was to diversify my education as greatly as possible, and that way I was able to wholly, so to speak, wholly help a person in all facets of their physicality and have a true understanding to a very in-depth degree of the body, so that I can truly, as a professional like yourself, analyze them and tell them what they need. And
But a lot
not
of it is you may see a trainer for maybe an hour, and then I'll see you in a couple of days, or I'll see you in a week or so. They're sometimes not worried about what are you doing at home, what are you doing outside of the gym setting to make sure your body's staying healthy in between, like doing the roller, like making sure things are loose, making sure you have a routine so you're rehabbing even if you're not seeing that trainer.
Yeah, that's true. I think that what you just said is a great point. I also believe that it's on an individual basis.
Mhm.
So some clients, because where they're at, it may just be to start out that they only are really performing any type of physical activity under my supervision,
Exactly.
because they're going to hurt themselves, or they don't really know, or they can't remember, and essentially it's like just not a good idea right now for you to be doing anything on your own.
Well,
You
sometimes
just
they may even be scared, like, "Hey, thank you for telling me that, because I was going to go for a run with my buddy John because you want to go for a 10-mile run." So you're helping them restrict their activities. You're giving them boundaries so they don't have to think about it. I think a lot of it is you're allowing people to just tell me what to do, and I trust you enough to get me to a better, healthy state.
Yeah, I think that, assigning homework, so to speak, which is kind of what you're talking about there, is part of my job. But it's very important that I am very careful with what I tell somebody to do at their house, and I make sure in my facility first that they're able to demonstrate to me both verbally and physically how to do something before I ever recommend that they do that at home.
Perfect.
I think it'd be very foolish on my part to say, yeah, go home and, just stretch. Go ahead and go home and do some light stretch. That's freaking stupidest advice you could give as a professional,
Yeah.
because you don't know what that means to them in their mind.
It's like,
They
okay,
need,
I what do I do? Yeah, and they may do something that they've done before. That's how they hurt themselves.
maybe it could be, or it could be they don't really understand, or never been taught, like, how to truly lengthen their muscles in a way that's going to promote a greater range of motion in a safe manner, you
Exactly.
know.
That
And we
makes
talk
sense.
about stretching often on here. I mean, stretching should be gentle. It's not an aggressive activity.
And you
It
have to
should be
spend
gentle.
time with it too, right? You can't just go, I have 2 minutes to stretch. I'm going to get it all done in 2 minutes.
Shorter periods of time is when you would involve more of a dynamic type of stretch,
Hmm.
where the muscle is lengthened and shortened in more of a movement type of way, less of a static type of way. Static mean held for longer periods of time.
Yeah. So you want to give
Yeah,
yourself time to get to that point.
I agree with you.
Yeah. Yeah. Yeah.
Yeah, for
And
sure.
going away from the hamstring, I would kind of change the talk around a little bit too. What's a common upper body injury?
Oh, the shoulder.
Okay. Okay.
Absolutely, hands down. I have. That's one of the reasons why I took quite a few continuing educational courses on the shoulder.
Yeah.
My favorite one being from Mike Reynolds. I took Mike Reynolds' course. He's the athletic trainer for the Boston Red Sox, and
Wow.
I took his course from him personally, and learned every single thing you could absolutely learn about the shoulder. Because if anybody's got to know about the shoulder, it's that guy,
Of course.
you know.
Throwing
And
motion.
yeah, so I took his course and absolutely loved it. I thought it was so well done and so thorough. And so that's the most common injury, Anthony. It's usually in the rotator cuff, and it's as a result of poor spinal posture and poor scapula movement patterns.
And how would you walk through someone, just a quick assessment of that? If you're getting someone to come in, you've seen them for a while here and there, but you've seen them before, or her, and now you're seeing them again. What's a quick assessment you would do with someone that's coming in with a reoccurring or re-injury of their shoulder?
Oh, absolutely. You just do a general orthopedic evaluation of the shoulder. That usually includes range of motion, through different planes of movement. So the body is divided into, like primarily, different sections where we
Okay.
kind of cut the body in half uh, down the middle, and then we cut it in half on the side, and then we cut it in half through the middle of the body like this, which is referred to as the transverse plane. So what we do is you want to assess the shoulder joint's ability to move through each one of those pains. And years of study has showed us that when a person receives pain at different degrees within that range of motion, it indicates something to the professional.
Okay.
Also, from there, you then kind of try to assess for this thing that's very common to people. It's called impingement.
Okay.
And generally, impingement occurs when the scapula is in a position that's generally too high up on the rib cage.
So it's more
And
like
so
coming forward and up, right?
yeah,
Okay.
because it could be. Yeah, I like to use the word up, doc, because that inhibits. If you can see me here in the video, when my shoulder is like up like this,
Mhm.
it's going to inhibit my ability to raise my arm through complete flexion, and that's what causes the scapula to kind of move down and around the rib cage and stuff like
Okay.
that. Okay,
You lose range
so
of
when
motion with your shoulder because of the scapula being up. Then, correct?
it's inhibiting optimal movement of the scapula on the rib cage by the muscles, and because of that, it's like it gets stuck.
Okay.
You
Okay.
can think of it like that. That's a real general way to say that. You know what I'm
Got it.
saying?
Okay.
So we test for impingement, and then you kind of want to look at the rotator cuff as isolatively as you can. So I usually would lay them down in the supine position, which means face up. And then I'll just bring that humerus kind of out to the side, which is the upper arm bone, and kind of get it kind of even with the collarbone, and make sure that the humeral head is resting very much in the fossa, which is the layman's terms for the fossa is socket. And so I want to make sure that the humeral head is resting in the socket there, and then I'll kind of twist it, and you just really are looking for a reply back from that client, and you want to kind of see if there's any pain, and then and if there's no pain, that's great, and then I look for optimal range of motion both through
Good.
external and internal rotation. And science has showed us after years of study, for a general population person, there is a degree of range of motion that we would consider to be like adequate for life health.
Mhm.
And then for an overhand throwing athlete, like a baseball player, a tennis player, a volleyball player, some type of sport that requires the shoulder to be brought overhead like this and through this movement pattern like that, there's a range of motion degree that is a little bit more excessive for those type of athletes that we have found to be best in preventing injury as well as enhancing performance during competition.
So you're looking for where they are versus what a normal range should be. Is that change per age of the client too, of the
Well,
athlete?
generally speaking, as people age, their range of motion in that shoulder joint, it does decrease. Now, I have to be careful with the way I answer that question, because somebody who is very, like, let's say they're very into their flexibility, they enjoy yoga, or
Yeah.
they understand the shoulder to a certain extent, and they take care of their shoulder, right? And they're 65,
Yeah.
and they're in great shape, and their shoulder is completely healthy. And if I were to take, you have these tools that you use when you hold it up to the shoulder like this, you kind of measure the degree with this
Yep.
tool. It's like a tube, and
It's called a
that,
protractor.
huh?
A protractor, basically, right?
Sure. Yeah, man. I mean, yeah. And so it's like it lets me see the degrees, and I can, really, if I want to, get an accurate reading on their range of motion, both external and internal, and I can evaluate. So if I'm working with a guy that's like, like a double A guy in professional baseball, or a guy that's in the major leagues, I will pull that tool out, because
Yeah.
I have to ensure that thing is perfect,
We
because
want to be
there's a
able to
lot
interpret
of
that
repetition.
information to their agent, their coach, their team trainer. Hey, this is where this person's at, and how do you get that baseline and improve that over time?
Yeah, absolutely, Doc. You got it, man. And for the general person, you can do that too. But a good way to think about it is you want there to be almost the same range of motion in both directions,
Got it. Okay.
both internal and external. And most people out there lack internal range of motion. Their
To
internal
clarify
range of,
there, to internal, are you talking about with the elbow down or the elbow up here?
yeah, so if here's my arm,
Okay.
external range of motion would be backwards.
Okay. So elbow
Internal
is
range
at
of
the
motion.
shoulder level then. Got it. Okay. So back here. Got it. Okay.
Yeah, this is internal range of
Got
motion
it. Okay.
here, like this, right? Most people lack an ability or lack adequate internal range of motion like this. And so I do a lot of manual um, PNF type stretching with people like that. And it works really good. And stretching is about consistency, and it requires a lot of patience
And we talked about a
because
shoulder range of motion stretching. What's the average amount someone should spend stretching their shoulder overall at one time, say daily?
well, first of all, before I comment on that, I want to say that you need to be extremely careful when you are stretching out your rotator cuff yourself, okay?
Uh-huh.
Because you have to be very careful with that, especially in internal range of motion.
Yes.
Okay, I mean, if you wanted to, you could YouTube it, but if you're going to YouTube it and you're going to look at, I'll do a YouTube on it. I'll
Good.
thoroughly explain it. I would love to do that,
Good.
but you better make sure that the person teaching you that stretch is an orthopedic surgeon or a doctorate or master's in physical therapy, or they have a CSCS or a sports medicine type certification
Sure.
like myself. You know, that's not to say that there is a great certified personal trainer out there that's been training for 15 years and they got it down. I'm not taking anything away from those people, but generally speaking, that's not the case.
Well, I've
Okay.
seen a lot of people that I've even done, for example, gone to a yoga instructor trying to show them how to stretch, and now they've hurt them shoulder trying just to stretch it even more.
Oh, dude, when it comes to yoga, okay,
Yeah.
you have got to be so careful because yoga is good for the body, but
Mhm.
yoga is like an extreme thing. And it
Well, there's
usually
different
it does
levels too, right? Different levels of yoga.
absolutely, you bet there are. And there is those people that do those unbelievable yoga moves
Mhm.
and stuff like that. Those people are usually they have a condition what's called congenital laxity,
Yep.
which means yeah, okay, it means that they were born with an extreme amount of range of motion in their joints, way more than the average person has. Okay,
Well, the first time I
so
did yoga was a vinyasa, I guess a medium or higher level yoga. And I left the room. I could barely walk out of the room, first of all.
dude.
I was sore for 3 days from the neck down.
Oh, you got to be careful. You know, you
But
got to
it
be really
motivated me
careful.
to go, how do I get back here so that I gain that laxity, that flexibility over time? Some people would go like, I'm never going back ever.
Ever, yeah. That's why I believe that flexibility should be done in from a clinical
Yep.
standpoint first. Clinical meaning like where they are very the body is positioned in a way where it is very specific in the muscle that is being lengthened. Where yoga, which would be kind of like holistic or organic or collective way to stretch the body, is where there's multiple muscles being focused on being lengthened at the same time, requiring a lot of brain activity and usually a lot of stability as well
Yep.
from the body, so that the joints are held in a certain way while others are lengthened and stuff like that. You got to be careful. It's a little bit risky there. That's why
Very
I
similar to being an athlete on the field where you're having to go through motions where you're having to hold your balance, be flexible in one area, but strengthen the other area too to hold your body. So, like you're saying, it's not something to go in lightly. You have to be ready for that, okay? Or let your instructor know, hey, I have this injury. How do I do a different move so I make sure I don't make that injury worse?
yeah, that's absolutely true. I mean, yeah. I agree with you 100% with that. You have to. That's where I believe that things should be, especially in the foundation phase here. What I do with a lot of clients, Doc, is I try to get as isolative as I can in the joint, make sure that everything is functioning optimally first, which usually includes mobility and flexibility. And
That's good.
then once those things are rocking and rolling, then you can start taking the body into more complex movement patterns, where the
Yep.
brain is required to do more activity and stuff like that, because the body is in a state where it can achieve that.
Well, and does the brain have to learn where a good pushing point is, where something's uncomfortable, maybe a little sore, but not painful, it's going to cause injury? Does the brain have to learn that?
Are you referring to from a flexibility standpoint or from what?
More just starting with flexibility, then from there to strength, more flexibility to start. So if I'm stretching my shoulder in external rotation, at that point, I want to know, okay, how far can I go before I have an injury versus I'm going to throw a ball? My mind might remember exactly where that point is.
Yeah. You know, again, it comes back to seeking professional help and having the professional determine whether you are in an optimal range of motion in the joint.
I think a lot of
But
sometimes that cut you up, but is you want to make someone feel uncomfortable, but it's still safe to go there.
Yeah.
Sometimes
So
they've lost that position.
Here's how I would reply to that would be that when you're stretching yourself, here's like a hypothetical question.
Good.
How do I know how far to stretch myself? Is that what you're getting at? Okay. So first of all, stretching should not be aggressive.
Good.
Stretching should be gentle. Okay, and what I mean by gentle is you are going to reach what's called an end range of motion in your joint. Okay, once you reach that end range of motion, essentially you're at the end. You can't go any further.
That means the end, right?
Yeah. But what we're trying to do is create a new end.
Good.
So what you try to do then is you try to take that joint that is being flexed because the muscle there's a muscle that is being lengthened. When one muscle is lengthened in the body, another one is shortened.
Good.
And so you want to try to take that joint and shorten it a little bit more. So what you have to do is gently feel yourself creep past that end range of motion, okay? Or attempt to. It may feel like, a few centimeters. Now, what most people do is when they stretch themselves, they think that by being aggressive in the stretch is going to improve flexibility. When you are aggressive in a stretch like that, your brain receives a signal of possible.
1 second. The mute button one here.
About that, Doc, I got a phone call right there.
Got it. Okay, good. Okay.
So what's going to happen is the body is going to protect itself against this injury response that the brain is receiving, and it's going to tighten itself up.
I call it guarding.
Guarding, you got it, Doc. It's going to try to do the exact opposite of what it is that you're wanting to do. So you can't do that. Okay, it's for one, you're putting yourself at risk for strain. I remember that I went through this period where I wanted to truly understand the muscles of the pelvic area and what it would be like to have optimal flexibility in those muscles. So I really went deep inside understanding how to lengthen those muscles so that I could perform the splits, both through flexion, extension, and then the adductor splits where the legs are out wide.
And Derek, you have that congenital issue where you have a lot of flexibility, right?
I'm right there. I am very loose jointed. I've always been flexible my whole life. I was a pitcher all the way through college. I just have that kind of genetics in my body, but in the hip area, I was pretty good, but not great. So I had to go through the process of really understanding how to get myself to that extreme flexibility. Okay. And I was able to do it. I was able to do full splits, hands in the air through flexion extension, and just about full splits through the adductor. I could never quite get that where you would, basically you're able to get your legs completely out to the side and roll all the way down to the elbows. I was very, very close with that. But I was very thankful for that because to achieve something that extreme for myself, I had to go through the process just like I would with a client. Yeah. And it takes a long time. You have to be very, the two keys that I would give to anybody who wants to improve their flexibility, the number one key is consistency. Mm-hmm. Yeah. You have to be consistent with it. And the other one is being gentle. So you are consistently gentle in lengthening your muscles on a regular basis. And if you want to improve flexibility quickly, I would say that it would need to be done 3 times a week. If you are sore from flexibility training, then you would need to take it back a notch. I don't believe.
And add a third one too?
Go ahead, Doc.
is being patient.
Oh, absolutely.
Whatever time you think it's going to take, multiply it times 3.
That's really good advice.
1 week
Yeah.
is going to take probably 3 weeks.
Yeah, it takes time, like you say, Doc. It takes a lot of time, and so you just have to accept that, because if you don't accept that, you're going to get frustrated because the muscles aren't lengthening, and tension in muscles breeds frustration in people. You
And
know what I
people
mean?
come to you or me with an injury, so now they have the injury to take care of first, then they can work on flexibility. So they have a step, even they have to go even one more step before they get to flexibility.
Mm-hmm.
Yeah.
Yeah, you're right. Yeah, but I like flex. Flexibility is key. The joints need to be able to move through an optimal range of motion for optimal physical health. But to take it a step further, for people who are very flexible, usually a lot of the times they lack stability.
Yes.
The congenital laxative person, which I mentioned, or people who have pretty good, flexibility, especially a lot of athletes too. When I get them, they come in here, they're like, yeah, I'm really flexible. And then I'll check out their stability, and their stability sucks. And that's why they're not as fast as they want to be. They're not as able to jump as higher. Sometimes with basketball players, they're not as able to jump as high.
Well, and if anything, is flexibility, as you have become more flexible, do you have better balance? Do you have better strength? Do you have better just overall body health?
You have the possibility for improving all of those things.
More potential.
You do, Doc. But without stability of the joint, the flexibility it's good. It's not, there's nothing wrong with it, but the body's still not going to function optimally, especially in an athlete.
Exactly.
And in the older population, I'd say 65 and older. I train a lot of guys that are mid 60s that come in here, and man, they still bang the iron and work out very hard. And they're fun. I love those guys.
Old man strength, right?
Yeah, dude. I'm almost 40 now, and you know what? When you start getting those late 30s into 40, you can get stronger again.
Yeah.
It's crazy, But what I'm getting at with the comment about the value of stability is that the great flexibility that a person may have or desire is only going to be optimized if the joints can be held stable.
Good.
Yeah, you got it. And the reason for that, just to give a quick explanation of that, is your body has to transfer energy. And if you lack stability in a joint, your energy is going to leak out of that joint, as opposed to being harnessed inside of the joint and shot up the kinetic chain to whatever it is that you're trying to do with your brain and body.
Nice. That joint can be, like you mentioned, your shoulder, it's a shoulder injury, or your shoulder blade, or your biceps. If it's a hamstring, maybe it's not just the hamstring, maybe it's the knee, maybe it's the hip, maybe it's the ankle. You have to go almost one joint or two joints away from that, say, injury point or muscle location to get the actual source of where you might be losing some of that energy.
Yeah, it is. That's yeah, I agree with you. That's
In
usually
general,
the case.
obviously, it's not. I'm just a chiropractor. What do I know?
No, Doc, you got no. You're right on the money with that. You do. And there's a lot of debate in my industry about how far can you go? You got a guy like he has a reoccurring shoulder injury, and some people will try to relate it to the ankle because that's the way the body, the energy transfers up the body. They're saying the right ankle isn't mobile enough. It's not stable enough. The muscles of the lower calf and tibialis, they're not strong enough, and so because of that, the movement pattern isn't fluid enough, and because of that, we're getting excess strain on the shoulder. It's like, good Lord, how. But I mean, how far do we really got to go? But what you said it's usually the case. I'm a believer in that, and that's why I assess for it.
And I think that's when you look at that at that point, you're allowing those areas are more commonly the injury points or the inefficient points, if you want, or more unstable areas. So when you look at that, you're dealing with a general population, yes. But if you're looking to, for example, a Red Sox #1 pitcher on their rotation, you may want to check out their shoes. You may want to check out their toe mobility. I don't know.
Yeah. When you get to that level, those guys will. It comes down to how well that they perform in their physicals dictates how much money they get.
Yeah.
So they are very, very thorough in those evals that they do with those guys, because I mean, essentially a professional athlete is is an employee of the owner of the team, and
Hmm.
so that owner of the team is investing into that athlete as part of their business equation, and they fit a role in that equation, and they want their working part of that equation to be as optimal as possible.
That's all it is. That's all. And again, we're just average Joes. I'm trying to make it to work every day. I'm trying to
Yeah,
get out of
man.
my bed to my shower to my car to my work. That's all I'm trying to do.
Me
And
too,
I
Doc.
like the show turned out very well, Derek. And this is our first time doing Zoom. Hopefully, we can get back to normal next month, a month afterwards. I think a lot we talked about is going to be how do we get the body to slowly get back to functional level. We talked about, I think initially, the primary goal is getting more flexibility by having more joint stability first. Is that correct?
Joints, yeah, it starts with stability,
Mm-hmm.
and from a movement standpoint, you want excellent mobility.
Mm-hmm.
Yep.
And if you go from mobility, then flexibility, then we get the body in our next show, hint, hint. How do we move down to more muscle strength
There you go,
or
Doc.
other joints and even balance too? To now that's your I want to say the fourth or fifth step. We talk about assessing someone's human body from say an injury point to now we can start working out. We can start hitting the weights, hitting the cardio, the coordination movements that we needed maybe in a yoga, maybe in a gym setting, maybe in a personal training setting like yourself, to get them to move in the proper direction. So the result of throwing that pitch where they want to throw it at that speed becomes their result.
Oh, that's well said. And to add to that, I would say that's one of the things that as a trainer that you have to do for the client. You have to give the client what they need,
Mm-hmm.
number one, but you also have to provide for the client what it is they want. Okay. I mean, people come in here and they're 20, 30 pounds overweight. They're like, hey, Derek, I need to lose friggin' 30 pounds, bro. So
Yeah.
you need to help me lose that 30 pounds. Okay.
Well, I'll
And
see for
so
the next year and a half to do that.
yeah. So that's when you do get into the nutritional side of things. You do have to get involved in their personal life a little bit and find out what type of decisions they're making with their time and their food choices. And the more open people are with that, the faster I am able to get them where they want to go. But you also have to do things physically for people. So professionally, how you organize routines. You can put a
Yes.
person through stability, mobility, flexibility, and core strengthening routines, as you can organize those routines in a way that get the heart pumping.
Nice.
And that, I don't want to come across in a way by any means that this is that my training studio is therapeutic. In a lot of ways it is therapeutic. Rehabilitation is part of my job, but I also have found a way to take that and turn it into like fitness, okay, so
Yes.
to speak, where they're coming in, they're being corrected, but they're also moving forward towards their goals, and we're doing that as fast as we can and as fun as we can.
Yeah.
So variety is key as the
Uh-huh.
trainer to provide for the client, but it has to be effective variety, and the workouts have to be designed in a way that is very efficient, that maximizes the time that I have with a client and gets them everything they need and want in an hour's time every single time they walk into the door, every week of every month. That's what it's my job to do as a professional, and I love doing that. And so, for people out there who are watching this, and a lot of times they're nervous. They're
Yeah.
nervous to get started. They're nervous to go to a chiropractor because they don't like the cracking sound. They're
Yeah.
nervous to get into it working with a trainer because they're so afraid that they're just going to lift weights and get really sore.
Yeah.
That is so far from the truth. If you're working with a real professional, that professional should be working with you in a way that is exactly at your current ability level, that is taking you through gradual progressions
Mhm.
towards your goal in a safe and effective way, and you should not be overly sore.
I would
I
almost go
mean,
safe, effective, and fun.
fun, right on, Doc. That's
You going
perfect.
like, hey, I enjoyed what I did the last hour, hour and a half, whatever it might be.
It should be enjoyable. I believe it also should be educational. You should be
Mhm.
teaching the client about their body. They need to be learning more about their body, because half the times they're clueless. You know, they
Maybe he's
don't
facing
know.
the wrong friend. Fred at the gym is telling him, who's a big weightlifter guy, how to stretch, how to lift 500 pounds. For someone that's 100 pounds themselves, they're not going to get there, but they're almost giving him bad advice. So how like yourself, how do you educate them to filter out all the bad advice? This is what all you have to know.
Yeah, that's right. Yeah. That's
I
why
think
I love you guys. I love chiropractors, you know. I feel like you have to be there's so many different types of chiros out there, you know. But I mean I really like your style. You're very analytical and you are so precise in how when you manipulate me. I really enjoy it, and I really feel like that a person has to do both of those in order to achieve optimal health in their body. And another big thing, Doc, I think that you and I both can relate to on this is that people think it's so expensive, you know, and in some ways it is, it can be expensive, but I mean, I have programs that I mean any household income could afford.
Is it expensive relative to seeing your primary doctor, then getting an MRI, then doing rehab, and then taking medications and spending 3 months not getting a result, and then going to see you?
It's
That's my concern. It's
that's
almost you're saving
yeah.
yourself time, saving yourself side effects of getting the wrong treatment or trial and error of treatment, then getting yourself to where now you have built more scar tissue in your joints. Now you need even a longer recovery. They're
Mhm.
taking care of it now, so you're done with it. At that point, you figure out how to take care of yourself at home. Boom, you're ready to go.
Yeah, yeah. I mean, having a goal and creating a time frame to meet that goal, that's my job. That's what I do.
Uh-huh.
You know, I develop the program and I say on by this, here's your weight loss goals, and I give them a timeline and I say, look, by April 20th, you should have lost this amount of weight, and I break it down to the calories and I
Good.
show them, look, this is your daily caloric expenditure. This is the amount of calories you burn during a workout with me. This is the amount of calories you burn at your job. um, and I lay that out for them, and I give them a total, and I say, look, and this is the amount of calories I need you to consume, and then by this date, you should have lost this many amount of pounds, and it keeps them online and focused, and that is a big key there. Because in my line of work and in your line of work, it is, in my opinion, is it's about being, like you said, it's consistent. You have to
Consistent, and
be
also you
consistent.
have to want someone has to want to listen without going, yeah, but how about this? How about this? Like, no, just do what I told you to do, and you'll get this result. You find
You
clients
know,
like that, let me know.
yeah, that's very common, you know, and over, you know,
But
when I was,
how do I lose weight but still eat a gallon of ice cream every day, Derek? What do I do?
you know what, I'll be straight up with you. I've dealt with, I used to do with, like a little bit more of, I used to train some models, okay,
Okay.
and these women would, they like a lot of them loved, like Taco Bell or
No,
they,
gosh.
you know, they that kind of stuff. So what I would do is go on there and get the nutritional information, and I would incorporate that into their diet. But I would, you know, just to appease them a little bit because they
Yeah,
had to have it, you know. But
yeah.
I would just, you know, educate them on what was in that food and leave it up to them if they wanted to eat or not. But it was my job as a professional to make sure that they hit their caloric burn as well as their intake. So
You
that
don't do a plan A and plan B with them, right?
sometimes, Doc, you got to bend a little bit. You know, if the client's got a sweet tooth and they love ice cream and they're like, you know, Derek, I got to have ice cream, you know, at least twice a week. And I'd be like, all right, fine. You know, I'll
Yeah.
just put it in your diet. I'll put it in your diet. But the caloric intake for the day will not exceed because of the ice
You have
cream.
to do
It's not gonna,
four more hours of cardio because of that one scoop of ice cream.
I have learned the hard way. As a younger trainer, I used to beat them over the head with that. I would
Yeah.
tell them, you know, if for every beer you drink, it's 10 minutes on the treadmill.
Yeah.
That was my thing because that's the average amount of time it takes to burn 100 calories. So
Mm-hmm.
I'd say, yo, dude, you want to go out and drink 7 beers on Thursday night? Okay, well, I will include in your meal plan. You can have 2 beers.
Yeah.
Okay, I'll include that in your meal plan. But those other 5 beers that you drank, that's 50 minutes.
Yeah.
So, you know, I would do that, you know, and you know, but as I, you know, as the longer I've been doing this, it's like you got to bend. I've
Yeah.
learned you do have to bend a little bit more there. And
Once you
so,
see results, you go, okay, I'm getting results, but how do I get fast results? Now cut out those other 5 beers, and you'll be
yeah,
fine.
I definitely say that to them. That's for sure. Yeah.
All right, my friend. This is a great show. I think it worked
Yeah,
out
right
really
on.
well on Zoom today. I think I worked at least on my end the bugs out. So I'm gonna put this on YouTube hopefully next couple of days. Put a quick edit on the bottom too about the stretching, flexibility, and stability as being number one, and our little short talk at the end too. So people again will have link as a way to series this show in a playlist of show number one, and this again being show number two, and in this new social distancing environment. So I forgot to wear my
Yeah.
mask today. So wear my mask next time for you.
Yeah, that's cool, Doc. Yeah, what I'd like to do too the next time is hopefully I'll have my tripod by then, and then I can get on there and I can give them some physical demonstrations
Perfect.
about
Like it.
something, and just kind of show them.
Yeah,
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 it'd be cool.
yeah. It'll work out well, my friend. Thank you. I'll get the video to you. Hopefully, once again, go to YouTube, and we'll get all taken care of next week when I see you.
All right, I'll shoot you that text and then plan on being over there Monday.
Welcome, my friend. Thanks, buddy.
Yeah, thanks, Anthony. Later, bro.
So we start getting out of quarantine, and we start getting back to routine, start getting back in the gym. How do we get there and not cause injuries so we don't want to go anymore? All right? We all have memberships sometimes, and when we have memberships, the biggest thing gyms love to do is sell them and realize a lot of people will not show up at all. How do we get there? How do we even work with a trainer if it's efficient to make sure our body gets healthy and stays healthy for you and for what you want to do on the day, every day, and on the weekends? All right, so hope you enjoyed the show. Again, the show now has the highlights for 1-2, along with links to Derek's information and website, along with our previous podcast, not only a podcast, but also videos of those podcasts too. Enjoy the week, my friends. Stay healthy, stay injury-free, especially your hamstrings, shoulder, and other parts of your body. Have a great day.